The human mind possesses an extraordinary ability to influence our well-being and health. The placebo effect, a fascinating phenomenon, showcases the power of belief in medical treatments. Although a placebo is essentially a non-active substance or intervention, its administration can lead to significant improvements in a patient's condition. The placebo effect refers to the observable improvement in a patient's symptoms or overall health that occurs as a result of receiving an inert treatment or substance, simply because they believe it to be an effective intervention. The placebo is typically a sugar pill or an injection of saline solution, but it can also be a sham surgery or other some kind of procedures. This effect is not limited to a particular ailment but has been observed across various conditions ranging from pain management to mental health disorders. There is no single theory that can fully explain how the placebo effect works. However, there are a number of factors that are thought to play a role. The placebo effect operates through complex psychological and physiological mechanisms. Psychologically, a patient's belief and expectation play a crucial role. When individuals anticipate positive outcomes from a treatment, their mindset influences the release of endorphins and dopamine, which contribute to pain relief and a sense of well-being. Physiologically, the placebo effect can trigger changes in brain activity and neurotransmitter release, leading to real physiological responses. The context in which the treatment is given can also play a role. For example, if a person receives a placebo in a doctor's office, they may be more likely to believe that it will work than if they received it at home. The power of suggestion can also play a role in placebo effect. If a person is told that a treatment is going to make them feel better, they may be more likely to experience a positive outcome. This is known as the suggestion effect. The placebo effect has been shown to be effective in a variety of conditions, including pain, depression, and anxiety. In some cases, the placebo effect can be just as effective as real medication. For example, one study found that the placebo effect was just as effective as the drug Prozac in treating depression. The placebo effect's potential to harness the power of belief is garnering increasing attention within the medical community. Understanding and utilizing this phenomena could optimize patient care and augment the efficiency of traditional treatments. The placebo effect is an important consideration in clinical trials. When a new medication is being tested, it is important to compare its effectiveness to a placebo. Placebos are often employed in clinical trials as a control group, comparing the effectiveness of the active treatment against those of a placebo to determine the true effectiveness of a new drug or therapy. In order to minimize the placebo effect in clinical trials, researchers often use double-blind or triple-blind studies. In a double-blind study, neither the participants nor the researchers know who is receiving the real medication and who is receiving the placebo. In a triple-blind study, even the people who are administering the medication do not know who is receiving the real medication and who is receiving the placebo. This allows the researchers to determine how much the medication's effect is due to the placebo and how much is due to the actual medication. While the placebo effect can bring about genuine improvements, ethical considerations arise when intentionally deceiving patients by providing placebos without their knowledge or consent. Open-label placebos, where patients are informed about receiving a placebo, are being explored as a more transparent and ethical alternative. Additionally, understanding the placebo's effect mechanisms can help healthcare providers optimize patient communication and support, enhancing the overall therapeutic experience. The placebo effect demonstrates the incredible power of the human mind in shaping our health outcomes. It highlights the profound interplay between belief, expectation, and our body's response to treatments. Although more research is needed to fully comprehend its mechanisms, the placebo effect holds the potential to complement conventional medicine and improve patient outcomes. By embracing its power responsibly, healthcare providers can enhance the quality of care and promote a holistic approach to healing.